Good day. My name is Ziara Davis. I am a pre-nursing major, and today I will be giving you 12 words and definitions from chapters 5 through 8. Chapter 5, the cardiovascular system. The 3 words that I will give you are tricuspid valve, venules, fibrinogen and prothrombin. Tricuspid valve. The tricuspid valve controls the opening between the right atrium and the right ventricle. The term tricuspid means having 3 cusps or points, and this describes the shape of this valve. Tricuspid valve. Venules. Venules are the smallest veins that join to form the larger veins. Venules. Fibrinogen and prothrombin. Fibrinogen and prothrombin are the clotting proteins found in plasma. They have an important role in clot formation to control bleeding. Fibrinogen and prothrombin. Chapter 6, the lymphatic and immune systems. The 3 words that I will give you are lymphangioma, immunodeficiency disorder, and Staphylococcus aureus. Lymphangioma. Lymphangioma is a benign tumor formed by an abnormal collection of lymphatic vessels due to a congenital malfunction of the lymphatic system. Lymphangioma. Immunodeficiency disorder. Immunodeficiency disorder occurs when the immune response is compromised. Immunodeficiency disorder. Staphylococcus aureus. Staphylococcus aureus, also known as Staph aureus, is a form of Staphylococcus that often infects wounds and causes serious problems such as toxic shock syndrome or food poisoning. Staphylococcus aureus. Chapter 7, the respiratory system. The 3 terms that I will give you are epistaxis, diaphragmatic breathing, and antitussive. Epistaxis. Epistaxis, also known as a nosebleed, is bleeding from the nose that may be caused by dry air, injury, medication to prevent blood clotting, or high blood pressure. Epistaxis. Diaphragmatic breathing. Diaphragmatic breathing, also known as abdominal breathing, is a relaxation technique used to relieve anxiety. Diaphragmatic breathing. Antitussive. Antitussive, commonly known as cough medicine, is administered to prevent or relieve coughing. Antitussive. Chapter 8, the digestive system. The 3 terms that I will give you are temporomandibular joint, hepatomegaly, and diverticulectomy. Temporomandibular joint. Temporomandibular joint, commonly known as TMJ, is formed at the back of the mouth where the maxillary and mandibular arches come together. Temporomandibular joint. Hepatomegaly. Hepatomegaly is the abnormal enlargement of the liver. Hepatomegaly. Diverticulectomy. Diverticulectomy is the surgical removal of the diverticulum. Diverticulectomy.
Hello, my name is Tiara, and I am a health service major. I'm here to recite 12 medical terminology words from chapters 5 through 8. Chapter 5, beta blocker aneurysm vascular surgeon. Beta blocker reduces the workload of the heart by slowing the rate of the heartbeat. They are commonly prescribed for low blood pressure, relieving angina, and heart failure. Aneurysm. A localized weak spot or balloon-like enlargement of the wall of an artery. The rupture of an aneurysm can be fatal due to the rapid blood loss. Vascular surgeon. A physician who specializes in diagnosis, medical management, and surgical treatment of disorders of the blood vessels. Chapter 6. Antibody, rubella, and malaria. Antibody is a disease-fighting protein created by the immune system in response to the presence of a specific antigen. Rubella, also known as German measles or 3-day measles, is a viral infection characterized by low-grade fever, swollen glands, inflamed eyes, and fine pink rash. Although not usually severe or long-lasting, rubella is serious to women during early pregnancy because it can cause defects in developing fetus. Malaria is a parasite that lives in certain mosquitoes and is transferred to humans by a bite of an infected mosquito. Symptoms develop from 1 to 4 weeks after being infected and include fever, shaking, chills, headache, muscle aches, and fatigue. Chapter 7. Phlegm, nebulizer, laryngitis. Phlegm. Thick mucus secreted by the tissues that line the respiratory passages. Nebulizer. An electric device that pumps air or oxygen through liquid medicine to turn it into mist, which is inhaled by the patient via face mask or mouthpiece. Laryngitis is the inflammation of the larynx. Chapter 8. Xerostoma. Morbid obesity and colonoscopy. Xerostoma, known as dry mouth due to lack of saliva, diminished secretions of the saliva gland. Morbid obesity, also known as severe obesity, is the condition of weighing 2 times or more than ideal weight or having a body mass index greater than 40. Colonoscopy, the direct visual examination of the inner surface of the entire colon, from the rectum to the cecum using a colonoscope.
This concludes our vocabulary and definitions from chapters 5 through 8. Tiara and I would like to thank you for tuning in.